Today I am reading from the book Spirit of Homeopathy, part Philosophy, and the chapter number 19, Acute Processes. An acute process has an exciting cause, comes suddenly, has a rapid course, and end in either death or the recovery. Strictly speaking, acute disease are a state of being which has last for a limited period of time. Often, however, we are tempted to call such processes as infective hepatitis, pneumonia, coryza, or acute diseases, though these are pathological processes and not a state. Two observations can be made in such a cases. During the acute process, the state of patient has not changed from the one he had earlier, or in the acute process, the state is changed. We have to ask what the significance of each of the above types. It is obviously that if the state has changed, it needs to be treated another remedy. If the state remain unchanged, then we require either to wait and watch, repeat the dose, or go higher in the potency, depending upon the intensity of the case. Usually, an acute process is caused by an exciting factor, for example, psychological, physical, biological, or chemical. It is necessary to examine the intensity of the exciting factor, and we can do this by asking what percentage of people will be affected in the same manner by that factor. A causative factor can be called a factor of epidemic proportion. If it is intense enough to affect almost anyone in the same manner, we have seen two types of acute processes, where the state is changed, where the state remains the same. We also have two types of exciting factors, of epidemic proportion, of non-epidemic proportion. If we consider the change of state as A in epidemic and B in non-epidemic, and no change of the state means epidemic in C in epidemic and D in non-epidemic, then each of these type has different significance as far as the prognosis is concerned. Type A, there is a change of the state from an intense cause of epidemic proportion. Under the heading Type A, there is a change of state from an intense cause of epidemic proportion. What does that mean? It is likely saying that there is an epidemic affecting a large number of people, and this man is one of them. He has average vitality and averagely intense chronic disease state. He reacts to this particular exciting factor by change of posture to suit it. For example, when there is a war, all doctors, farmers, lawyers become a soldier until the war ends. The change results from intensity of the exciting factor, which necessitate that reactions for the survival. Now the questions arise, if this is the survival mechanism, why do we need to treat it? Why does the soldier state require treatment if the doctor become a soldier in a war as a survival mechanism? If the reaction was suitable to that cause, then why does it need a treatment? The answer is simple. It is that under an exciting factor, the state aggravates itself and blow out of proportion. As long as the war continues, the man will not just remain the soldier, but will keep on getting more and more intense as a soldier. Much more intense than is needed, and this can kill him. Homeopathic medicine brings back the reactions to the proportions required. Example, the optimum intensity that's saving life in acute conditions even when the state is suitable. This we have already discussed in the chapter of out of proportion reaction. Now type B, change of state from non-epidemic cause. Title, type B, change of state from a non-epidemical cause. For example, a doctor becomes a soldier at the menaced threat of war. A minor injury brings out an arnica state, or a slightest loss of blood brings on a China state. Two conditions are required for this to happen. There was a silent disease or exciting root of the state already in existence. This state, which was dominated earlier, was not equipped to meet this exciting cause. For example, in a calcarea person, the slightest fright can cause a stamonium state because the calcarea state is not equipped to handle the situations of terror. A healthy man is equipped to face it, but calcarea state has to change. Likewise, arsenic state of the hyoscyamus state is capable of facing the terror, but not the calcarea. This can frequently be seen in the acute asthmatic attack, where the patients may require remedy like arsenicum. In the acute, some slow remedy like baryta carbonicum in their chronic phases. Means arsenic is used in acute state and baryta in chronic state. This can frequently be seen in the acute asthmatic attack, where the patients may require a remedy like arsenic in the acute and some slow remedy like baryta in a chronic cases. Now type C, state unchanged even when the exciting factor is epidemic or intense. For example, a person gets 40% burn and remain in the same state as earlier, or there is a big injury and the person remain phosphorus, does not become arnica. During the acute pain of the injury, he still like a likes sympathy and wants to be touched, opposite of the arnica. This means that the chronic state is so intense that it tries to manage it all acute crisis without changing the state. His conditions are so strong that they cannot be changed. The doctor, even during war, remain a doctor when everyone else is become a soldier. Now type 4 is type D, no change of state in non-epidemical course. This means that his state is able to manage the exciting factor without needing to change. If after some time of homeopathic treatment, a patient who has been in the same state even during acute troubles develop a change of state from a not so intense course, this is a good sign. It shows that the strength of dominating disease has gone down and this has allowed the other state to come up. For example, a man has a both doctor and soldier state within him, and the doctor state is very intense. Even during war, he remains a doctor, right? You keep treating him and now he becomes a soldier with the threat of war. This means that the strength of the doctor state has gone down and now the soldier state is excited. He cannot back to the doctor state once the threat is over. But during the exciting factor, you could see the soldier state coming up. So now you will be cautious that after further treatment, the soldier state came up even without an exciting factor, and alternation of the soldier and doctor treatment may be required until he is cured. Means if there will be alteration of soldier and doctor, the treatment is required until the cure. Now under the label satellite and distinct state. Now question is what is the difference between a state of stamonium produced in a calcarea person, as you mentioned earlier, and person who distinct state of calcarea and stamonium? Answer is the former I call satellite and the later I call silent state. What is the difference between a satellite and silent state? A satellite state is depending upon another state for its existence. The chance of the satellite state coming up are less and less as the original state goes down. As he becomes less of calcarea, there are a fewer chance of stamonium state coming up in him if the stamonium state is a satellite. The reverse is true. If the stamonium state in him is a distinct state, here less calcarea he become, the greater the possibility of the stamonium state coming up. A satellite is like a branch of the tree. When you cut down the tree, its branch will also be cut off, but the other tree will become more prominent. Usually, a satellite remedy is regional remedy. It shows in a specific region and with a special purpose with no such prominent mental and journals. It comes up because its main remedy is not able to cope with that specific region. At that time, the original mentals and generals of the previous remedy will be suppressed, and the satellite will take charge of the whole, but it will concentrate only on the part. If a calca patient lifts a weight, he gets a sprain with the typical Rostock's modality. At that time, the original calca state will be suppressed, and the patient will be hoping about about the seeking relief from the pain. There may not be any mentals of Rostock's, except probably some restlessness. If if left to itself or with some balm or analgesic, this pain will disappear. If the calca state is taken care of later, the chances of his spreading occur so easily will also diminish. Similarly, calca will have other satellite sphere like glandular inflammation of the belladonna or fear and fright of stramonium. A remedy is called a satellite only if the state is excited by something that normally cannot excite such a state. For example, a bit of dust causes lot of wheezing. A patient can be cured without even once used a satellite remedy. The whole satellite state can be relieved with time or local treatment. But if it is a distinct state, it cannot be cured without a medicine or with local treatment. It will persist until the right medicine is given. Also, we must always examine if what we think of as a satellite remedy does not fit the entire case even after the acute crisis is over. Many times we have prescribed the nux vomica for an acute complaint only to find even the chronic one improve drastically, which means that in fact the main symptom of the case were also covered by nux vomica. It is for a reason also that we like to ever prescribe the satellite remedy, because for all we know, one of them could inadvertently be the right medicine for the whole case. For all we know, for the whole case, and we would be left with the mistake impression that it was just a satellite medicine. Therefore, when in doubt, it may be advisable to use the local measures, rarely even allopathic medicines such as pain relievers and bronchodilator, to tide over the acute crisis, so that we are at least sure which medicine is working or not working. The satellite will be in some way the opposite to the main remedy, otherwise it will not be the satellite. It will possess at least one quality intensely which is main remedy does not have. The acute inflammation of the belladonna, the acute terror of the stramonium, and the tremendous amelioration by motion of toxicodendron are all features which are opposite to mild, slow, indolent calca. Also, one must remember that even though we call this satellite, even though they are dependent upon the main remedy, there are full-fledged disease in their own right, and any disease which lasts for too long is bound to develop its own root. When such a root is developed, you will find that now you have a full rust tox in the picture with the mental state and generals of the remedy. Then it is no longer a satellite. It becomes a disease in its own right and can be transmitted as such to the next generation along with this root of the main disease. So that is the next generation, the satellite become a separate disease, and this time an exciting factor will bring about the full blown picture of that disease, which will not subside without the without the indicated remedy. Example 1. A man of 25 years presented with infective hepatitis with a high bilirubin SGOT-SGBT. He had many symptoms common to hepatitis, such as nausea and decreased appetite, but his craving and aversion remained unchanged. His state of mind was also the same. He was a very mild person, answered by nodding, was social, affectionate, and did not like any quarrels. During the hepatitis, I saw no change in his state from what it was before. I gave him Persitla and recovered beautifully. He required no other medicine even after his recovery from the hepatitis. In such case, where there is no change indication in the acute conditions, you will find a very strong state. Of course, at this time, there will be symptom of the acute stress factor. For example, in case of injury, a person will have pain and swelling. But what we have to see in the mental state and general state. If the mental and general state has changed, then the change of remedy is required. If it is not changed, despite the fact that all the local symptoms have changed, it still does not require change of remedy. That is why I say the indication of the change is the change of indications. Example, change in the indicating symptoms. If the indications on which you have based your remedy are changed, then only will you change the remedy. Another example is that I am treating a man with a diabetes and chronic myeloid leukemia. His remedy is arsenic out, and for past 3 years he has required nothing else. He has had a several acute crises, a severe tooth infection and cellulitis, which were also tackled by the arsenic out. He wrote in the form, I have consulted several doctors, all have spoiled my health. He could think of nothing else but his health. It has blood count went up to the 400. Then he would calculate that if every 3 weeks it went up to the 400, then at the end of the year it will be up by certain numbers and he will die. He was very cautious and mistrustful. He had very little space for others. After 3 years of the arsenic herb, he had significantly relief from his anxiety, with concurrent relief of the diabetes and control of the leukemia. At about this time, his sister, who was also my patient, had some problem in her own life and came to seek my advice. I was a bit rude and strong with her because I felt it was required. She complained to her brother about this, and it made him so angry that he came to my clinic and could not speak. He was trembling and even said that he would like to strike me. You must remember that he was beaten with my treatment, and I was the only physician in whom he had a trust. If he antagonized me, it might not be good for his health. He regards me with respect and knew that my intention was good. But to my surprise, he went into the intense tachycardia state from an exciting cause, which in my view was not so intense. Tachycardia helped him beautifully, and he was again back to the arsenic state. It was a good sign. The tachycardia state is not very dependent on arsenic. This root silent disease existed in him. Since the arsenic state had gone down, the allowed the tachycardia to come out. If a chronic state, there is an acute phase. If in a chronic state there is an acute phase, for example, headache and vomiting, but the general state remains the same or a little better, do not touch the case. You need not interfere only when the state inside has gone up in intensity or has changed. If the person says, I am better, but yesterday I went out so I got headache, leave him alone. But if he says, for a minor reason, I have a severe headache, you are reevaluate the case. You may have to give another medicine or the same remedy in the higher potency. Now another case, example 3, a man of 36 brought by his relative for treatment of acute schizophrenia. He was violent and had to be tied up in our hospital since he was attacking everybody. The history was that he was an artist who was poor and had got married to a very rich man's daughter. This woman had a congenital deformity of one arm and therefore could not find a suitable groom. Her father decided that the best option was to find a poor man for her and support him in coming up in life. After the marriage, there was a lot of domination of our patients by his father-in-law. One day, after a serious insult, this man became openly abusive and violent and developed this acute condition. The symptoms of the case fitted into the higher summers. which in tandem potency after a few days brought him out of his state. I then studied his case again and found his remedy was the Staphysaria. Since Staphysaria is known for its suppressed anger and suppressed violence as well as its control. It is such a person who, when provoked beyond a limit, needs to become expressively violent and lose control, which he precisely the state of hyoscyamus. One can say that here the hyoscyamus state depends upon the underlying Staphysaria state. 8 months after this, the patient had a minor relapse of hyoscyamus state, which was again promptly brought under the control with the hyoscyamus. He had been on Staphysaria since then, and in the past 6 years, he has remained quite well, despite several exciting factors. In summary, treat the state that exists the present moment. If it out of proportion to the cause, then treat it, but if it is in proportion, leave it. Do not treat it. Treat the state with the remedy for that state. I like to give the example. If someone is setting fire to your house, catch him and stop him rather than inquire who has sent him.